Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Colibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
This is Dr. Candace Pierce with Elite Learning by Colibri Healthcare, and you are listening to our Elite Learning podcast, where we share the most up-to-date education for healthcare professionals. Welcome to today's podcast series focused on a really often overlooked but really incredibly important issue in healthcare, health literacy. And at its core, health literacy is about how well patients can obtain, understand, and act on health information and services, to be able to make appropriate decisions about their care. Low health literacy is surprisingly widespread, affecting about 1 in 3 adults in the United States, according to the national estimates. And unfortunately, poor health literacy has been linked to poor health outcomes, higher hospitalization rates, decreased use of preventative services, and really an overall higher healthcare cost. And despite these far-reaching impacts, we see many providers still struggling to effectively communicate health information in a really clear, actionable way for patients who have limited literacy skills. And most recently, health literacy has emerged as a critical area of focus for policymakers and healthcare providers, educators, our public health advocates. So on this podcast, we're going to dive into the practical strategies to really bridge that gap. And joining me for this discussion is Dr. Kathleen Wools. Kathleen, thank you so much for joining us for this discussion.
Oh, thank you for inviting me. This is such a passionate topic of mine.
Absolutely. Can you share a little about yourself and kind of your expertise and passion in this area?
So I live in the Midwest and have been involved with a free and charitable clinic for the last 25 years, both started as an RN, became a board member, became a nurse practitioner, and now I'm the president of the board. But still remain a provider. And it's been interesting because I was working with the free and charitable clinic before there was the transition to universal health care under President Obama. So initially, our demographic was very specific. It was really the people between like 18 and 26, 30, who just didn't get access to healthcare. They were still in college, but their parents no longer covered them under their insurance because of their age, et cetera. Well, then all of a sudden we changed, and then we became different. And one of the biggest changes we became was we do a lot more non-documented, because under universal health care, it kind of addressed a lot of those issues that we were seeing earlier with people that were, age-wise, people that had low-paying jobs that weren't allowed to get insurance, those type of things. So the demographic kind of changed. So it made the disparity a much more complicated issue than it was previously. So previously, we were dealing with younger people or people that had minimum pay jobs. And so a lot of their issues, of course, focused on those things. Now with social, economic, political, it's homelessness, mental health, it's so different now. So I also taught nursing for a while, and I had the advantage of bringing student nurses in to start learning about this topic. It's such a complicated and complex issue, and it's almost like we all have to do something to address it.
Absolutely. Can you really further define what is meant by health literacy and why it's so crucial for especially those patients that you see in your clinics?
I think when you just look at the surface of health literacy, you always think it's an access issue. If we just had enough access to patients. As I said earlier, I co-own 2 primary cares, and we do a lot of public aid patients. And there are so many issues with just that population where it's about access, but it's also about access to specialists. It's access to transportation. It's access to education. But then you start to look at the populations and where they come from. Now it's access to safety. If you don't feel
Mhm.
safe going out of your house, do you really think you're going to try and go to a physician's office?
True.
It's literacy. It's estimated 130 million people in the United States do not read at a sixth grade level. All
Mhm.
medical information is based at a fourth to sixth grade level. So we already have a population that cannot even understand what we're giving them. Now we add non-documented, and we add the asylum seekers, and we add housing, and we add food, and we add
Mhm.
homelessness, and we add
Mhm.
substance abuse, and we add mental health illness. And then people are struggling to survive. They're
Right.
really not interested in access to healthcare. Or how do we make them believe that healthcare is part of this? So the issues are so complex to try and get someone in the system and then
Mhm.
help them navigate the system. I'm sure, Candace, you can reflect on personal journeys you've had that you're well educated and comfortable with the system, and the little games you've had to play and the people you've had to
Yes.
call and the systems that you had
Yes.
to circumvent in order to get
Right.
what you need. And now you take someone who is new to this country, doesn't understand the language, has
Mhm.
uprooted everything they know, and now we're telling them, oh no, you have to call for your mammogram on a yearly basis. It doesn't
Right.
make sense to them. So
Right.
when we talk about health literacy and health and access to care, it is such a complex issue. It's not a one size is going to fit any of this.
Well, you're talking about those who come over, the asylum seekers, and English is a second language, and I laugh about this not because it's funny per se, but healthcare itself, it's almost like we have our own separate language
We do.
from English. And so you have somebody coming over here who is, learning English or knows, English as their second language. And I actually have had a couple of foreign exchange students, one from Macedonia, one from Korea, who have come to our home. And so you really get to see how funny English is because you're trying
Right.
to help them. And now I'm trying to help teach you the medical lingo, which is its
Right.
own separate language. It can get really confusing. So, what are some of those major consequences or risks for those patients who have such low literacy skills?
I think, one of it is just education. People don't understand. It's hard enough with people that have been educated in the United States. Even your average person, they go to the doctor's office.
Mm-hmm.
The doctor starts explaining things to the patient. The patient may or may not understand it, but they don't understand the volume of what's being said to them, or they
Yeah.
don't understand that there may be a piece in their history that's really pivotal to any decision that's made in the medical area, but
Mm-hmm.
they don't know that. And a lot of times you find out things after you've asked them a different question and you're talking
Right.
about one problem, and then all of a sudden they bring up, oh, and by the way, I was diagnosed with this disease process 6 months
Mm-hmm.
ago. Well, now you've changed everything. So those
Yeah.
are people that actually kind of understand medicine, and they may be very well educated people. Now we take people that didn't even grow up in our healthcare system. So vaccinations are not something that they do. All right.
Right.
So, in
Mm-hmm.
the Midwest, we're seeing an outbreak of measles because we are an asylum city. And now all of a sudden, people from other countries are not, immunized. We can look at TB, and you have to understand that these people that are asylum seeking are not bringing these diseases into the country because they want to. They don't even realize these are diseases that we don't have, that have been eradicated in the United States, because in their country, TB can be endemic. Do you know what I mean? Like
Yeah.
they all get
Mm-hmm.
BCG shots, which don't count. And do you know what I mean? But they don't know any better. So there's a lot of things that we take for granted when we look at this literacy, that it's hard enough for us that are well educated, and then you complicate it by, like you said, lack of the English language, access to care, afraid. A lot of patients are just afraid to even seek medical care because they're afraid they'll be deported.
Right.
So
Absolutely.
when we start looking at this issue, it's every day I'm always humbled by even my private patients who will forget to say something or tell me about a medication they're on because it has nothing to, they have a cold. So they're like, well, I have a cold. Okay, what medications do you take? I don't take anything. Well, then, in healthcare, we're able to pull up your medical records. So we
Yeah.
pull up your pharmacy records, and you're on 15 meds that make a huge difference as far as my treatment process goes. And now these are people that are well educated that don't know it. So then how do we deal with people that are not even getting their meds in the United States to try and prevent complications? And again, it comes down to, how do we educate patients to understand how important these things are? And I think that COVID really affected a lot of people and their opinion on physicians. So one of the interesting things we're seeing now in healthcare is patients don't have primary care doctors. They go to urgent care, especially that. Oh, absolutely. That
it's
age
hard
group,
to get into primary care.
Absolutely.
So you just end up going to urgent care.
It's absolutely true. So now we've created this whole other issue, because it used to be years ago, and I just had a conversation with a patient about this. Your primary care steered the ship. So if you were a patient of his or hers and you had an issue, he would say, okay, I'm going to refer you to pulmonology. And then pulmonology would call back the primary care and say, this is what we're going to do. And the primary care basically would say, okay, I agree, or no, I don't agree, or I can take it from here, whatever. Now you've got 15 doctors. If you have private insurance, and you have access to specialists, you have now 15 doctors, and nobody knows what the other one's doing. So then all of a sudden you are coming in, and then everybody's answer in primary care is, oh, well, you should see a specialist for that. Oh, are you having, menorrhagia? You should see a specialist. Oh, you have a runny nose? We'll send you to an allergist. Oh, you have a cyst? Go see a dermatologist. And then they say, well, I can't get into anybody. And really forbid, if you don't have private insurance and it's not good, you're not seeing any specialists. The FQHCs, especially in the Midwest, they provide primary care, the, county boards and stuff. Once you need a dermatologist, a oncologist, a, surgeon, you're done. There is no access for you, because they are not taking them. Our dermatology appointments for a public aid are 2.5 years out.
Yes.
2.5 years.
Yes. We ran into issues with that for my oldest daughter with endocrinology. Like we could never get in. And our pediatrician, and he's really great. He'll give us what we need, but he does. He's like, well, I'm going to send you to this person, and I'm going to send you to this person. He'll give you any referral that you want. He's like, I treat runny noses and upset stomachs. Like that.
So it's really, access now is a general thing. So what we're seeing in our private practice is between the ages of probably, and now we're getting into the 60-year-olds. Prior to this, we've always been 20s, 30s, and 40s. That's kind of been our group. Now we're starting to see 50 and 60-year-olds who are also having access issues. Even with Medicare, good insurance, they still can't get in. So people just go to an urgent care. My average is I do 8 pap smears a week, walk-in pap smears of people I've never seen before in my life.
Yeah.
And now you think of how many times you've walked in and had a pap smear. We just don't. So this health literacy is kind of like, you're a doctor, you're a doctor, you're a doctor. Y'all must be the same kind of doctor, and y'all must be good. So I don't really need to pick and choose who I'm going to go to. I can just go online and look, and then find, oh, look, they have an appointment at 8:00 tomorrow. I'm off tomorrow. So now I'll go in there and just see that provider. And I don't think anybody realizes what an impact on health literacy that is making.
Right.
Because then there's no follow-up.
Right. Well, and, I know we're kind of talking a lot more about, English as a second language and asylum seekers, but, you can be really highly educated. You can have a doctoral degree in something and still have low health literacy.
Absolutely. Like you had said earlier, we are a different language in healthcare. Providers use terms like, you are reaching the end of your disease process. Well, to me, that means I'm cured. It doesn't mean I'm dying.
Or it could mean, I was going to say, or it could mean we're dying.
Right. Oh, I'm dying now. And there's times when even I say things, and I have a tendency to talk fast. So sometimes I'll even say things like, you have to fast 6 to 8 hours, assuming everybody understands what that means. And slowly I'm beginning to learn. And these are not asylum seekers. These are actual people that have come up through the healthcare system. they don't always know what that means. So something as simple as saying, this is your lab work, you have to fast 6 to 8 hours. You have to kind of take that now another level and make sure they understand that you have to, what does fasting mean? So now you have to say, so now I try to say, all right, 6 to 8 hours before you have this done, we're looking at your blood sugar and your triglycerides and cholesterol. So we want you not to eat or drink anything but water. If you want to have coffee, it has to be black, no mint, because evidently people use breath mints. And then I got, that caused an issue. No Tic Tacs, simple little things that we don't even think about. That we are now facing. No power drinks, no. So it's very interesting to kind of take a step back and realize that lack almost of that primary care provider or that one person has really trickled down and caused a lot more issues with health literacy.
Yes. So what role can and should nurses play in identifying patients' health literacy levels?
I think that as nurses, I think as there's going to be a difference between each level of healthcare. So as providers, I think it's a little bit, on us to make sure that we are saying things the way they need to be said. I also think we have to be stewards of good medical management, which means we have to look at the tests we're ordering. We have to look at, the medications we're prescribing. We have to look at how we're educating our patients on preventative care. But again, it kind of goes back to if you live in a high-risk neighborhood and you're afraid to go out or let your children play outside because of the potential that they can be hurt, you are not going to worry about getting enough sunshine for your vitamin D level. So It's really, if you're homeless, you're not concerned about getting your yearly mammogram. And why we tout the importance in literacy of making sure patients have preventative care. It's very difficult when there are huge social issues or just grade levels where they don't understand. Well, I had a mammogram once. It was negative. Do you know what I mean? Or I've done, I don't have any history of breast cancer in my family. And there's a lot of studies that come out, and the news is very good about talking about the studies, but they're not always transparent with the studies. So then people get information from very many different vehicles. You can get it from TikTok. You can get it from Instagram.
Oh, TikTok is huge right now.
Huge.
Yes.
Huge. And so then I think it really comes down to us as nurses, pharmacists, providers, respiratory therapists, CNAs, every one of us to help educate our patients to understand that you have to go to a reputable source. It was kind of like when COVID first started and everybody was getting their information online. And so then all of a sudden we had a ton of conspiracy theories and we had a ton of this and a ton of that. And the physician I was working with, he was so good. He'd always say, these are the websites you should check. These are the websites. Go to these websites. Yeah.
And I always go to TikTok. Is that what you're saying?
Yeah, exactly. Or I tell them, you know what? These are the people I follow on TikTok and Instagram. They are excellent. They are medical professionals. They give you the good data. They research the studies. So really use these as your references. So I think we have to involve social media. I think we just have to teach people how to do it safely. So I think that, just because I'm an influencer and I'm going to now teach you something doesn't mean I'm correct. And so I think we can have those conversations with our patients. Where are you getting your information from? Not in an argumentative way, but we should be having those discussions with patients all the time. Do you know about preventative care? Do you know about supplements? Supplements a whole nother issue with health literacy. Yeah. Again, if it's sold over the counter, it has to be safe, and we all know what's going on with, all of that. So I think we have to start with educating, but we have to be careful. You don't want to be lecturing. You don't want to be like showing, oh, look how much more knowledgeable I am about this than you are. So I think we walk a fine line in healthcare. I think trust. I think that the bottom line is we have to establish trust with patients. Really hard though when they're bouncing from urgent care to urgent care for all of their medical needs. And
absolutely.
And there's a difference out there in the quality of care. And unfortunately, we have a lot of corporations that have gotten involved in medicine. And some of it is good and some of it's not so good. And, it's always been a problem with medicine when people outside of medicine decide they're going to run medicine. Because it's much more complicated than that. So we're seeing a lot of, just cookie cutters. You go in with a cold, this is your cookie cutter response. You go in with a cough, this is what you get. And unfortunately, then, they go to 3 or 4 urgent cares, they're treated the exact same way, nothing changes, and then there's a catastrophe. So how do we empower the patient to then start asking the right questions too?
Because you can have high literacy levels and have low literacy levels in healthcare. But I think it also makes it a little bit more difficult when the insurance comes into play. Because you're already trying to navigate this. You're trying to figure this out. You're trying to understand. Because, I have high health literacy levels,
Right.
And I still had to fight and go through so many different people and ask all these questions to get where we needed to be for the proper treatment we needed for, like CRPS. So, and that was really hard. So I see that a lot of these complications and challenges that you see, it makes people, what, I just don't even want to fight it. I'm just gonna, and then you don't participate in preventative care.
Right.
You wait until it gets so bad that you have to go to urgent care or you have to go to the ED. So then you have poor patient outcomes. And so when we are talking to patients, how do you have some strategies, some skills of how we can, effectively communicate and educate patients with low literacy levels?
I think establishing trust is really big, which has always been one of the foundations of nursing. Do you know what I mean?
Yes,
Since the day you become a nurse, one of the foundations of nursing is in developing an empathetic, trusting relationship. And nursing does it very well. And so I think it starts there. And I think that it may not happen on the first visit. It may not happen on the second visit. But if you can get the patient to come back, you're already 50% of the way there. Okay. So I think what we do is we present in this trusting, accepting environment, non-judgmental. I happen to use humor a lot because it's comfortable for me and it's comfortable for my patients. I also use touch. And sometimes I think, oh, maybe you're a little too touchy. So I have to be careful. But I am a hugger. Do you know what I mean? And my patients will respond to that. I know who I can hug and who I can't hug. Do you know what I mean? But I find a lot of patients just kind of like the little touch on the back or there's some connection. Do you know what I mean? Not just standing there with your hand on the doorknob, waiting to get out of the room.
Or with your arms crossed.
Exactly.
Or staring at a computer, but actually showing that sincere interest.
Exactly.
And what they have to say.
Exactly. And I do not chart in my rooms. I come in my rooms and I sit down and I say to my patient, so tell me what's going on. So I always start that way. I never come in, grab the computer. It's hard for me time management wise, because I'm always charting some other time, but I just find it works a lot better for me to connect first and then talk about things. And we talk about one of the greatest things that my mentor taught me, the physician I work with, he said, always present everything as a team effort. So when you sit down with a patient, and let's say you have a patient who's very obese, okay? And because of that, now they have diabetes, hypertension, et cetera. He says, instead of judging them, which a lot of people will automatically do, or a smoker or an alcoholic or anybody that has some sort of an addictive process going on, he said, sit down with them and say, you're a smart person. You know this is unhealthy. You know that. What can I do to help you reach your goals? What can we do to get there? How can I make it so this process works for you? What can we do as a team? And I have seen that to be very successful, especially in people who have felt like they've been judged before and have really now based on, their literacy level, their access level, have really decided to shut down and have only been here because, like you said, they've been coughing now for 100 days and now they're scared. And so I
Yes.
think that trusting environment, I think starting that communication is so, so very important. I think, working with the insurance companies, everybody wants a prior auth for everything. And you just have to accept the fact that healthcare is very difficult right now and you're going to earn every dime you make,
Yes,
and
you are.
and there's nothing you can do about it. You are going to prior auth everything. And then, there's things you have to do. You may have a hurt knee. And I may know in my hearts of hearts, you need an MRI. But if I don't send you to physical therapy and try ibuprofen first, your insurance is never going to cover it. Do you know what I mean?
Right. Yes.
And I tell
do.
the patients that I am really forthright with it. Like, I know you need this and I would love to order it for you. I can order it. I tell them all the time, I can order anything. Whether your insurance covers it is what the problem is going to be. So I think being honest with them and letting them know I'm not the one standing in the way here. And also letting them know too that sometimes they may need something outside of you, and that's okay too. Like you're going to need to see someone besides me. I can't handle this. But again, I think when you look at these health disparities and you look at just, access to, their education of the homeless, addiction, it's really complicated. And I think that you just try to make little baby steps. And I think it's a process. I don't think anybody's going to turn around overnight.
Absolutely. So I know you have, two clinics that you are part owner of. So I really want to ask you, how can the healthcare system itself help to remove some of these literacy barriers, like through forms? Is it through signage? How we provide instructions? Like, how can the healthcare system help in this area?
I think that was a really interesting point for us, like a really good learning point. So, to make sure you have handouts, utilize teach back, make sure the patient can reiterate what you say to them. You have to have good signage. I mean, you like the vaccines, flu season, we had like 5,000 signs everywhere about flu seasons. Having a portal, a portal is a great thing. Patients can access their records if they have the ability to do that. And a lot of them do. Most people know how to use a phone, so that's pretty good. Google Translator. We use Google Translator a lot. And not just for asylum seekers, there are people that live in the United States that English is not their first language. And it is much easier for them to communicate in Russian or Polish or something like that than the United States, than English, especially when you're trying to explain a very difficult process. So sometimes their native language really helps with that. A lot of handouts. We do handouts via email, and we also do handouts we hand to them. Very clear instructions and communication between specialists. That's another really big thing that has to happen better in healthcare. You have to let us know what you found, radiology, getting results back from mammograms. I mean, the whole system almost needs to be revamped with the patient at the center, which I know we all said all along, but we don't have the patient at the center of this.
Right. Right. So how can we as nurses be leaders in advocating for these systemic changes to really start to prioritize health literacy?
I think we really need to start volunteering at that ground roots level. So being involved in a free and charitable clinic starts it, being involved with your legislation, being involved with your local government, and starting that process, really looking at the needs. Every county does these huge health assessments for the county, but very few people know that those even exist in their county. So you can contact your health department and they will tell you exactly what the health needs are in your county and how many patients, what is your health literacy for your county. And that's a really interesting way of starting it. Get involved in your medical groups, your professional groups is a great thing. Mentor new grads, talk to your fellow, providers. And really it takes a lot of work, but if each one of us did it, at the free and charitable clinic I work at, if every healthcare provider in my county volunteered, it would be 4 hours a week. or 4 hours a year for the whole year. They'd only have to volunteer 4 hours for the whole year.
That's eye-opening. That's
Isn't that?
huge.
Yes, it's huge.
That's huge. Yes. Well, we are at the time. Our time is up for this episode, but this episode really focused on you defining health literacy, explaining its importance. You explained it so well, and identifying a lot of those challenges, while also kind of giving us some practical communication strategies to use. Dr. Kathleen will be back in episode 2 to help us really understand the appropriate assessment methods, some teaching techniques, and how to overcome health literacy barriers and how to build up our health literacy skills. So make sure you check out episode 2.
This podcast featured content from an accredited CE activity provided by Colibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.